And like I mentioned before, there are other things that we look for. Again, it has to be present in more than one setting, and it also has to cause impairment and distress for the person. And that can be either socially, so with friends, it can be with relationships, with family, or one of the other things is occupationally, and obviously for children, their occupation is going to school and being a student. So if it's causing them impairment in that setting, then that's generally where we look for those things. Some of the exclusions and the other things that I'll try to figure out is, if there's another disorder that's present, such as pervasive developmental disorder or something on the autism spectrum. A lot of times those children, just with their own disorder, have problems with hyperactivity and focus and concentration. And if you talk with any of the experts in autism, to diagnose ADHD in a child with autism, it has to be above and beyond what you typically would expect in a typical autistic child. So sometimes that can be a little difficult to figure out as well, because I don't know how many of you work with autistic children, but a lot of times there's a lot of variability within that population in and of itself. The other thing that we have to exclude is whether or not there's schizophrenia or another psychotic disorder, or the possibility of another mental disorder that might be causing problems. Certainly we know that depression, one of the criteria for depression is problems with focus and concentration. And sometimes with that, we'll see hyperactivity, because one of the things that can be present with depression is psychomotor agitation. So I always do try to find out about a child's mood and what sorts of things might be going on there. Anxiety as well can be something that we would consider, because if a child is worrying about something, then obviously they're not going to be focusing and paying attention to what they need to be paying attention to. So I will generally ask about worries, or if they tend to feel anxious, or if their parent notes that or has heard that from other people. Some of the other things that we would consider as well would be some of the personality disorder traits that might be present. Some of those can look somewhat similar to ADHD, although there's not really a whole lot of overlap necessarily between the symptomatology. Another big one that's kind of been in the literature lately is bipolar disorder, and certainly there is overlap between the symptoms of ADHD and bipolar disorder, including talking excessively and having a high energy level, because certainly people with bipolar disorder, when they're on the manic end of things, do tend to become more energized and tend to be on the go quite a bit. So that's something that again, I would be asking about mood symptoms. And certainly in children, bipolar disorder I don't think is very well categorized as of yet. I know it's something that's a hot topic in the literature, and people are really trying to figure it out. I think it's really difficult, at least the way the DSM-4 is now, to specifically diagnose bipolar disorder in children, because I don't think they have the neurological maturation to fully manifest all of those symptoms. But I'll leave that to those research experts to finish teasing out, because I certainly don't know at this point. But the other thing that I always do when I'm getting a history is to get a medical history as well. Some of the things that can be or look like ADHD can be seizures. Certainly if a child is having absent seizures, they're losing their focus just for a few seconds at a time even, and that can be look like inattentiveness. I also ask with everybody whether or not they've had a head injury with loss of consciousness. And in the rehabilitation literature, they're certainly recognizing more so now lately that even a mild concussion can cause some neurological deficits and problems with learning on down the line. So that's something that I usually will try to get a history about and include. A lot of times if kids have asthma, and are using a lot of bronchodilators, those certainly can cause a child to have a racing heart and make them look a little more speeded up. And if they're having frequent bouts of asthma and they're on steroids, a lot of children a lot of people in general can get almost manic on steroids. So that's something else that I try to find out about, whether or not that's something that we need to maybe have a discussion with their primary care doctor and see if we need to make some adjustments there. Sleep apnea. Certainly sleep disturbance, especially in kids. If you've, and I'm sure a lot of you probably have experienced this, had a very tired child, they don't necessarily know how to wind down and soothe themselves and can be, pretty hyperactive. And certainly if you're not getting enough sleep, you're not really able to focus and attend. So, I'll ask about some symptoms that may be associated with sleep apnea, such as snoring. Are they a mouth breather? Have they had maybe frequent ear infections or sore throats? And take a look at that, and may, before I necessarily pursue medication, ask to have a sleep study done so that we can make sure there's not something going on there as well. Sometimes endocrine problems, such as having a hyperthyroid, can make somebody look more hyperactive. So if there's a family history, perhaps, of thyroid problems or some concerns about that, then I may do some lab work and look at their thyroid. And also looking for lead poisoning, especially if somebody lives in an older house that may have lead-based pain. Can be some other things that I would look at. Speaking to the prevalence of ADHD, the literature says that about 3 to 7% of children will meet the DSM-4 criteria for combined and hyperactive impulsive types. If you add in the inattentive type, the ADHD inattentive type, then that number doubles to 6 to 14% prevalence rate. And there certainly can be some persistence of ADHD into adulthood. Right now, the prevalence is estimated to be about 3 to 5% of adults would meet DSM-4 criteria for all types of ADHD. Risk factors for ADHD, and again, a lot of this I'll kind of try to tease out as I'm getting my history, would be heredity. It's a very highly genetically transmitted disorder. It's not uncommon for me to hear from one parent or the other that, well, I had a lot of symptoms like this when I was in school, but it wasn't really diagnosed back then or treated, but I think I probably did. That's not an uncommon statement for me to hear. Also, male sex. Boys actually tend to have it, or seem to have it, a little bit more than girls do. There's a 3 to 1 male to female in community samples per the studies, and 5 to 1 up to 9 to 1 in clinical samples. So people who are actually seeking treatment, a lot of times, more often than not, it is boys outnumbering the girls. And I think that a lot of times in girls, it may be missed until they're a little bit older. Boys do seem to have more hyperactivity associated with theirs, and the girls tend to be a little quieter and have more of that inattentive type, so they don't necessarily draw the attention of the teacher in the classroom, and then that a lot of times is what will trigger the investigation and looking into that. Some other risk factors, a lot of times I do take a pregnancy and birth history, and with that I'll ask about tobacco exposure, because that can, tobacco exposure during pregnancy can lead to a higher risk for the development of ADHD, as well as maternal alcohol use during pregnancy. And then some perinatal factors, including prematurity or very low birth weight.